What if I told you the best filler treatment is not the one that makes you look different today, but the one that still makes you look natural 5 years from now? Most people think fillers are just about adding volume, but the best injectors think very differently. They think about your face long term. Fillers should never be planned month to month. They should be planned year to year, because your face is constantly changing. As we age, we naturally lose collagen. Fat pads in the face slowly shift. Bone structure subtly changes. Skin becomes less elastic. Good filler treatments respect this process instead of trying to fight it aggressively. This is actually where many people end up looking overfilled, not because they wanted too much, but because there was no long-term plan. Some treatments focus only on what looks good immediately, but strategic treatments focus on how your face will look over time. A skilled injector doesn't just ask, "Where do you want filler?" They ask, "How can we support your facial structure so you actually need less correction later?" Because strategic placement can actually maintain your structure longer, prevent the need for excessive filler, reduce future corrections, and help your face age more naturally. This is why experienced injectors often use less filler, not more, because placement matters more than quantity. They place filler where it structurally supports your face, not just where volume is missing today. Many patients also ask this question: if I start fillers, will I need more and more forever? The honest answer is not if it's done properly. When filler is done with a long-term strategy, the goal is maintenance, not escalation. You're not chasing volume, you're maintaining balance. You're not reacting to aging, you're planning for it. This is the difference between what we call reactive filler and strategic filler. Reactive filler says, "Let's fix what bothers you right now." Strategic filler says, "Let's protect your facial structure so you continue to look natural over time." For example, instead of repeatedly filling smile lines, sometimes supporting the midface or cheeks reduces the need to directly fill those lines over and over. Instead of constantly adding more lip filler, sometimes improving surrounding facial support helps lips look youthful without overfilling them. This approach is called structural planning, and it's one of the biggest differences between average filler results and very natural, elegant results. Because the goal should never be more filler. The goal should always be better planning. The most beautiful aesthetic results usually have one thing in common. You cannot tell filler was done. People just say, "You look refreshed. You look healthy. You look well rested," not, "What did you have done?" That happens when treatments respect facial proportions and anatomy, natural balance, anatomy, and a conservative approach. Because good aesthetic medicine is not about changing your face. It's about protecting what already makes you look like you. If you've ever been hesitant about fillers or worried about looking fake or unnatural, the most important factor is not the brand of filler. It's not the price. It's the strategy. It's not even the number of syringes. It's the strategy. Good filler is not about doing more. It's about doing what is appropriate for your face. And when done properly, you shouldn't look filled. You should still look like yourself, just more refreshed, more balanced, more confident. The safest way to approach fillers is always through a proper consultation. Because every face has different anatomy, every face ages differently, and every plan should be customized. Long-term thinking is what protects natural beauty. Because the best filler work isn't the result you see immediately. It's the result that still looks beautiful years later. Real aesthetic expertise is not about how much filler you can add. It's about knowing when to stop. And planning for your future face. Because when filler is done correctly, less really does become more.